Hello, my name's Professor Ketan Dhatariya, and I'm a consultant in diabetes at the Norfolk and Norwich Hospital in Norwich in England. This very short video is to try and help you, if you have type 1 diabetes, get through sick day rules, especially in this time of COVID-19. The single most important thing that you need to be doing if you're unwell is never stop taking your insulin. Your insulin doses may actually need to go up, because if you're unwell, your body is producing lots of other hormones that actually are there to try and raise your blood sugars, even if you're not eating and drinking. And even if you don't feel like eating and drinking, you must keep regularly checking your blood sugars as well as your ketones. Hopefully your primary care physician has issued you with some ketone strips and you have a meter that can check your blood ketone concentrations. If your ketone concentrations are less than 0.6 millimoles per litre, that's normal and you're okay. So you can keep doing what you're doing. Hopefully you'll be able to eat or drink a little bit. If you're unable to eat, it's important that you still drink. Try and drink 100 mils or so every hour, slowly by sipping if you need to. If, of course, you're vomiting and you can't keep any food or medicines down, then you'll need to seek some urgent medical advice. If, however, your ketone concentrations are down to between 0.6 and 1.5 millimoles per litre, then you'll need to keep checking your blood sugars. Now, hopefully your blood sugars will remain less than 11, but you need to remember that you can get this condition called euglycemic DKA, which is where your blood glucose concentrations may actually remain completely normal, but you may still develop quite marked ketone production and become quite unwell. You shouldn't necessarily just rely on glucose, but if it does rise to above 13 or 14, then you should certainly be checking your ketones. But even if you're not well and your blood glucose stay low, then if you do have the opportunity to check your ketones, you should do so. If you're checking your blood sugars and your ketones, you should be doing them every 4 to 6 hours, even during the night. If your blood glucose concentrations rise, or if you have ketone concentrations which are still less than 1.5, then you may need to add some more insulin. Examples of sick day rules exist all over the place. And what I'm about to tell you is just an example, but your own care team may have given you something more specific for your individual circumstance. So, for example, if your blood sugars are between 11 and 17, you may need to give yourself an extra 10% of your total daily dose of insulin every time you give yourself some insulin. If your blood sugars are higher, say between 17 and 22, you may need to give yourself 20% of your insulin. If your blood sugars remain higher than 22, then you should seek urgent advice at your earliest convenience. These things are important. The most important thing is to keep checking your blood glucose, keep checking ketone concentrations, and never, ever stop taking your insulin. If your blood ketone concentrations are higher than 1.5, then you may need to give yourself much more insulin. Again, either 10 or 20% of your total daily dose. The way you need to work out your total daily dose is to just add up all of the doses of insulin that you take during the day. And if that's 100%, you divide that by 10, and you may need to give yourself 10% of your total daily dose if your ketones are between 1.3 and 3 millimoles per litre, or 20% if you're higher than 3 millimoles per litre. The other thing that's important to remember is the new class of drugs called the SGLT2 inhibitors. So those are things like canagliflozin, empagliflozin, dapagliflozin, and ertagliflozin. These drugs can give you euglycemic DKA. So you could have quite profound ketoacidosis with a glucose concentration which is completely normal. And therefore, it's important that if you are on one of those drugs, if you have type 1 diabetes, and you don't feel very well, that you do check your ketone concentrations far more regularly and don't rely on glucose to be the marker to make you think that you may be unwell. Check your ketones if you're on one of those drugs.